elected, President-elect Joe Biden calling it his patriotic duty and all of ours to wear a mask. And 100 of the nation's top healthcare systems agree. Hospital workers across the country are urging Americans to mask up to help slow the spread of the surging coronavirus. And joining us now to talk more about it is the Chief Medical Officer of Scripps Health, Dr. Ghazala Sharif, MBA. Hi, doctor. How are you?
Hi, thanks for having me on today.
It's our pleasure. Tell us about this campaign trying to get everybody to wear their mask.
I'm actually so excited to tell you about it. 100 healthcare organizations across the country, including Mayo Clinic, Cleveland Clinic, and our own regional healthcare systems coming together to spread the message. And it's much more powerful when we unite this way. It's a single voice, versus just the chief medical officer at Scripps urging people to wear masks. So I'm hoping that people pay attention when all of us have come together to spread this message.
So for people who just don't like wearing them and they know they're supposed to and they're kind of uncomfortable, what do you tell them?
Our numbers are going up in San Diego. We're actually nearing where we were in July. Our ICUs at Scripps are 84% full. So what I would plead of you is if you don't want to wear it for yourself, then wear it to protect your loved ones, because it is heartbreaking to watch somebody you love be in the intensive care unit, not allowed to have visitors. And if there's one thing you can do to protect them, it's wear your mask. So do it for somebody else that you love, even if you don't want to do it for yourself.
Yeah. Is it also, I mean, does a mask help the wearer as well? I think maybe if that's the message also, maybe they'll think, well, I want to make sure I protect myself.
Yeah, there's a lot of mixed messages, as you know, early in the course of coronavirus saying it doesn't help, but I do believe it does. If somebody's coughing and you have a mask over your own face, it will protect you. And so, yes, there is protection for yourself, and for if you have a cough, protects the person on the other side of the receiving end. So masks. Sure. Everybody.
Well, let's talk about just specific masks if we could. We hear about the N95, which seems to be the really tight one. That's what really protects the wearer. Then there are those kind of blue ones that look like maybe somebody in surgery would wear. I know I have some of those. Then there's maybe just the bandana, or there's the cloth one. I know some have those valves, which I guess are not very good because that lets the air come out. When you're talking to people about what kind of mask to get, what would you suggest?
So you're very well versed on the mask, and I commend you for that. Yeah, we don't like the one-way valve. It's great for the wearer, but as you said, it exhales. So those are around you. You're exposing. Surgical masks are best if you can get them. Remember, initially when we first had this outbreak, there weren't enough surgical masks, so we were saving those for healthcare workers. But now, as they become more available, simple surgical mask is great. The cloth masks work well. They're not as good as a surgical mask. The bandanas and the gaiters are not good protection at all. Some of them are so thin, and you've probably seen people walking around. You can see right through them. Those are not good protection for anybody. So those, I would say, don't buy. The cloth masks are good, but you want to make sure you have one that comes really high up above the nasal bridge there. Otherwise, it doesn't work. And whatever mask you wear, I guess my plea is to wear it properly. I see so many people walking around with their mask under their nose. Remember, that's part of how you expose other people. And so if you're going to wear it well, and wearing it below your chin doesn't help anybody, not even your chin.
That's right. What about these face shields? Sometimes you see the person, maybe they've got a mask and the face shield, or just the face shield. Does that help?
The face shield helps if you're wearing a mask. We actually are asking our healthcare workers to give them an additional layer of protection. I'll always try to go above and beyond what the recommendations are for our staff. So if you can wear a surgical mask and a face shield, just the face shield alone, if you're coughing, keep in mind it doesn't keep out all of those aerosolized particles. So the face shield alone is not as good as a mask, just to contain everything that you're coughing.
Dr. Ghazala Sharif with Scripps Health. Great to see you. Thanks for the information.
Thanks. Have a good night.
Okay, you do the same. We'll encourage everybody, wear your mask. It really helps. Okay.